The work we're doing here is to come up with a much faster way of characterizing antibiotic susceptibility. The methods that are traditionally used in clinical laboratories need a wait for the bacteria to grow before we can say whether they will respond to antibiotic treatment or not. And that's frankly not fast enough for the clinicians who are treating patients with severe infections. They need to know now, preferably yesterday, what they can use, not tomorrow what they can't use. We're working on much quicker methods of developing that appreciation of antimicrobial susceptibility.
For patients with serious infections, those that are in the hospital or in intensive care, every hour without appropriate antimicrobial therapy can mean up to a 10 to 20% risk of mortality for that patient. So if we can do this 21 hours faster, the chance of that patient surviving is much, much higher than current. So we take very small numbers of cells and we expose them to the antibiotic for a very short window of time. And then we use an instrument called a flow cytometer that is capable of looking at the individual bacterial cells, and we look for the damage the drug is doing, and from that we can make predictions about whether or not the drug will be effective in a patient in approximately an hour's time. Our dream for this project is to reach a point wherein we can do this as a very simple test on a small instrument in the actual intensive care ward or in the emergency department, so right at the point of care for the patient, so that doctors no longer have to rely on their knowledge. They have evidence to tell them what the best drug for that patient is right there and then.